Hello everybody, my name is Dr. Stephen Stokes. Welcome to my channel. Today I would like to talk about the relationship between GERD, acid reflux, gastroesophageal reflux disease, right? And heart disease, with a couple of articles that came out recently that show the correlation. But more importantly, I would like to give you some ways to overcome GERD if you have it, and thus lower your risk of heart disease. And I also want to draw this correlation between what we know about the inflammatory disease process in a localized area and how that affects the entire body. This is really eye-opening. I wish more people would pay attention to this, but if you really pay attention to what I'm going to say, this should change the way you look at disease in the human body. It is that dramatic. So first of all, what is GERD? Like I mentioned, it stands for gastroesophageal reflux disease, and it happens when the acids in our stomach sort of splash up into our throat. The tissues of the throat are not designed to handle high acidity. So when the acid goes up there, it basically burns the tissues. And if this happens infrequently, then you could argue that it's okay, your body can recover. But if this is something that's happening on a daily basis or very frequently, it can cause damage to the tissues of the throat that can lead to serious conditions like Barrett's syndrome, or even worse, even esophageal cancer. And esophageal cancer is a very difficult, challenging disease to treat. It's not something anyone wants. It's something we want to avoid, right? And hopefully, after you watch this video, you'll take steps to reduce your GERD and to avoid these more serious conditions. The reason that this happens is because of this valve that's located at the bottom of your esophagus. And this valve is called the lower esophageal valve, or the lower esophageal sphincter. And, when it's healthy, it stays closed when the food is in your stomach and it doesn't allow the acid to come up into the throat. But if it gets unhealthy, there's many reasons for that. If it becomes a disease process and it gets weak, gets tired, it gets loose and flappy, I guess you could say, then it can cause that acid to go up into the tissues of the throat where it doesn't belong. There's a lot of reasons for this. Sometimes it has to do with certain foods, alcohol, smoking. We know these things weaken the ability for the sphincter to stay shut. Some people have problems with chocolate, for example, that can cause that. Other people have problems when they drink too much carbonated fluids. All that carbonation gets in the stomach, produces a lot of gas, and that can push the valve open. And probably clinically, what I see the most common cause for GERD is stress. It's your body being in that sympathetic stress state, and that leads to the weakening of that esophageal sphincter. Now, let's just take a look at these studies that I mentioned before I get into what we can do to fix this. So the first study was the Journal of Translational Internal Medicine. It investigated the relationship between GERD and cardiovascular health. They discovered people with GERD have higher blood pressure, altered cholesterol profiles, and increased risk of heart attacks and high blood pressure. They're saying that the risk of myocardial infarction, which is basically a heart attack, goes up as high as 27% more likely to suffer a heart attack if you have GERD. That's pretty high. Next study is in Frontiers in Cardiovascular Medicine, and they found a relationship between GERD and irregular heartbeats, also known as arrhythmias. These heart arrhythmias can be a very serious problem. They cause a lot of horrible symptoms, but also they increase your risk of stroke and other sort of nasty conditions, not something you want. They found a 34% higher risk of developing arrhythmias if you have GERD. And finally, a study published in the World Journal of Clinical Cases revealed a 46% higher risk of developing high blood pressure if you have GERD. So there's no question that if you have GERD, your cardiovascular risks all go up pretty dramatically, right? And the reason for this is simply because GERD is an inflammatory condition. So GERD is producing all of this inflammation in the tissues of the throat. And then you ask, well, how does that relate to the heart? And this is the major takeaway that I got from the article that I hope you understand. What we're suggesting is that isolated inflammatory processes in the body, for example, with the throat in GERD, can lead to systemic involvement. So repeated inflammation in the throat can strengthen and develop inflammatory pathways in the immune system that can lead to inflammation in other organs, in this case, in the heart. This to me is profound, right? Because what we're saying essentially is that if somebody has chronic knee pain, right? Chronic arthritic, degenerative, inflammatory knee pain, then if that's left unchecked, if that is something that does not get taken care of, over time that can lead to developing inflammatory pathways, strengthening inflammatory disease processing pathways in the body, and you could get all of a sudden problems in other seemingly unrelated parts of your body. In this case, the throat, right? And the heart. And so more than ever, we want to stress that health is a whole body, a systemic event, and that so is disease. So we can no longer look at the disease process as being localized. Somebody has a bad knee. Somebody has a bad back. Somebody has a bad heart. We have to instead look at the entire person and say, is this person healthy or unhealthy? And if they're unhealthy, we have to treat the basic foundational mechanisms to create health in that person's system so they don't have all these other diseases. And that's really my takeaway from these articles. And this reinforces the way that I've always treated the human body and what I've always believed, which is that health is a systemic event, and so is the disease process. Now, if you have GERD, the ways that are typically used to treat that would be antacids. So, people will take Tums to temporarily neutralize the acid. They'll take H2 blockers, such as peptide AC. I'm going to go back to that in just a second. But most of the time, if you go to your physician, he's going to prescribe proton pump inhibitors, right? PPIs. And these PPIs are absolutely horrible for your body. First of all, they essentially shut down all production of acid in your stomach. You have to have acid to digest proteins, to digest your food. It's useful for so many processes, and you can't just turn it off, but that's what these PPIs do. They just shut it off. So it's not something that's going to be productive long term. If you have a very serious condition of acid reflux, if you've got a lot of damage in your throat, I would encourage you to take an H2 instead. So peptide AC will reduce the amount of acid produced, but it won't just turn it off. And it seems to be much safer. It has a lot less side effects. I would speak to your doctor about taking H2 blockers instead of PPIs, but that's something, again, for you to discuss with your doctor. What my approach would be that we want to do a few things. We know that if we increase the acid of the stomach, okay, so if we have acid in the stomach that's leaking up into the throat because the valve is faulty, the medical community says, let's turn off the acid. I'm saying let's try to get the valve to work properly. And the way to get the valve to work properly is actually increasing acid in the stomach. The acid signals the valve to close. So I would recommend that you begin taking a supplement, a digestive supplement with your meals known as Zypan. And Zypan is going to work wonderfully. You could take anywhere from 2 to 4 of these per meal, depending on the type of meal you have. If you're eating a high protein meal, you take more. If you're eating a more carbohydrate-based meal, you don't have to take as many. But you take the Zypan as a supplement with your meals. This will increase the acid in your stomach, and it will send the signal to the valve to close. And you can train that valve over time by using Zypan. Eventually, once that gets trained properly, you may want to switch from taking Zypan, which is essentially an acid supplement, to something more interesting like a bitter. And sometimes people will start with the bitters if they can't handle the acids, but I usually find that the Zypan is the best place to start. But bitters are herbs that you can take that, again, cause the body to produce more acid. So whereas the Zypan is a direct acid supplement that just increases the acidity of the stomach right away, the bitters are herbs that sort of train and coax your stomach to produce more acids. And you could argue for either way. Essentially, I like to have people take the acid right away because it produces an immediate effect. But if some people can't handle the acid, then I'll start them on bitters. And it just depends. You may have to try both and see which one works better for you. Now, if you have a lot of damage in the tissues already, if your throat is already, raw and damaged, you don't want to start by taking more acid. The first thing you want to do is heal the damage. And for that, what I would recommend is, as I mentioned, speak to your doctor, but I'd recommend Pepsid AC, taking an H2 blocker that's going to reduce the acid content. And yes, that is not going to directly affect the valve and make it work better, but it's going to reduce the acid. It's going to take the symptoms down in your throat so that we can get it to heal. And for that, I recommend a product called Gastrex. And Gastrex is a wonderful supplement that's going to combine some clay, some chlorophyll, and some tissue extracts that's going to really help heal the throat. And once that throat is healed, you're feeling better, then you can begin the process of taking either Zypan or bitters to retrain the stomach to work properly. And this will really have a profound effect, not only on your throat and your acid reflux, but apparently on your cardiovascular health. And so I hope this was informative for you. I hope you enjoyed this video. If so, please subscribe. Remember, you can get more information on my website, including free copies of my books. In one book in particular, Heal Yourself, I have a whole chapter dedicated to this if you're interested in the pathways and doing more of a deep dive on GERD, acid reflux, and the connections that has with your overall health. So thank you for watching, and I will see you again soon. Bye-bye.